The Health Secretary says he wants to finally defeat obesity by giving millions of people access to the jabs, Wegovy, Mounjaro, on the NHS. And it's estimated that 1.5 million people in the UK are already using them. But 9 out of 10 of those people are paying for their prescriptions privately. Prices vary. It's about £100 to £350 a month, depending on your dose and which medication. There are tight restrictions at the moment on who can get the medication on the NHS. There are even variations on who can get them between trusts, sort of postcode lottery. Obesity is estimated, of course, to cost the UK economy £98 billion a year. So maybe you think drugs that tackle it should be more widely available on the NHS. I'm going to start with you, Suzanne. What do you reckon?
I firmly believe that we have to get to the root cause, and I believe the obesity crisis is all about what we're putting on the shelves in the supermarket, the processed foods, the addictive foods, and it's all well and good giving out millions of jabs, but what happens when people stop taking the jabs? We go back to the problem again, and I think the funding should be essentially put into education and banning harmful foods that are causing this addiction and stopping the one for the price of, two.
Bog-off offers.
Yeah, exactly.
Yes, but when you say banning foods, you're not serious about taking chocolate Easter eggs off the shelves and saying you can't have pizza, you've got to have a piece of celery and some grilled chicken. I mean, you wouldn't go so far as to ban food, surely.
I mean, from my point of view, I think sugar is causing a huge problem. And I do think, there's certain ingredients and chemicals in foods that should be banned. And I think there is too much sugar in our foods, which is creating this crisis of obesity and creating the foods to be so addictive. I think take them off the shelves and start getting back. We have changed our ingredients over the years. Like bread is full of sugar. It never used to be. And that is all to make more money. It's all to give it more longevity on the shelves. And I truly do believe that that's where we need to change things.
All right, Sam, I wonder what you think about this. I mean, the idea of banning foods is going far further than the government or anybody else has ever suggested. Only Suzanne Shaw would dare to say that. I think she's not running for political office, though. What do you think about more jabs becoming much more easily available?
The thing is, the problem with health in this country, and the reason the NHS is so the bills go up every year and people say we can't afford to keep running, is public health. People aren't healthy enough. They are overweight. They don't exercise enough. Other Western countries in Europe don't have the same scale of problem as us. And it is to do with diet, it's to do with drinking and smoking and all the rest of it. And they've been trying to educate the public for years, but the problem hasn't been resolved. Now they've got a jab, right, that can help people. It's going to save millions, billions of pounds for the NHS if they prescribe this to people who would otherwise be a burden because of heart disease, because of diabetes, because of stroke and all the rest of it. So although in an ideal world, I think Suzanne's right, education, but they've been banging that drum for years. It's got them nowhere.
Absolutely.
And this is an emergency, a crisis in the NHS. They need to find a solution that's quicker.
And Nicola, I want to bring Nicola in because I feel as if, look, I've been a famous fat person for years and years, and I in the end, I couldn't even, long before the jabs, I had a flipping gastric bypass, quite big old operation, because I just couldn't deal with that. I could lose the weight, but I could never keep the weight off, and I tried. It's very difficult. So what I'm asking is it really about education, or is part of the obesity epidemic emotional eating? It's not that you don't know you should have an apple. You know you should have an apple. I can't believe anyone watching this doesn't know, I feel a bit hungry. It's not time for lunch yet. What should I do? I should have an apple. But do you want an apple? Will an apple actually hit the spot? Or do you really want a half a packet of bourbon biscuits, a couple of custard creams to finish off the spag bowl from last night, a bit of cheese on toast? It's not that education hasn't worked. It's that there's a big emotional pull somehow, a psychological pull that gets us towards the other food that we know we shouldn't eat, but we want to eat anyway. Or is that just me sitting here and everyone else has conquered that somehow?
No, so for me, I agree with what you're saying, but I also think we're missing the mental health. That's what it is. Nobody wants to be fat. I'm a recovering anorexic. I'm still bulimic. I struggle constantly with my body image and my weight. And nobody wants to be desperately thin and no one wants to be desperately fat. We shouldn't be putting money into the jabs as such, we should be putting it into mental health. If you go to the doctors with an eating disorder, it's very hard to get help. I weighed under 6 stone and I said to my GP, I need help. I didn't get any help because my BMI was fine. There was no way it could have been fine. I was desperately, desperately ill and unwell. I think the jabs work and they're fantastic. What happens when you come off of them? Because as you quite rightly said, you could lose weight. We can all lose weight. But then what happens when the food noise comes back? And if you've never had food noise, I admire you. Like, I envy you, not admire.
Me too.
But, you know, my food noise is massive. So, you know, the jabs would be great. But then what happens when, you know, that's why you need
they may find a way of just keeping people on the jabs. You know, if they agree with you and you feel fine and you keep slim and you're not plagued by, as you say, food noise. If people don't know what food noise is, it's the thing in your head that says, have a biscuit, have that sausage, finish off,
or don't
even
eat,
off the cake,
or don't eat
anything.
Stop eating, or eating and going and throwing up. You know, the food noise is absolutely debilitating.
Deafening.
The problem is we don't know the side effects as well to these jabs at the moment. We really do not know what the long-term damage could be because there's always a cost to something. There could be some horrendous side effects. I mean, they are reporting...
Well, hang on, before we do that, so far we've discussed it on this programme with lots of doctors, Dr. Philippa Kay and Dr. Ellie Cannon, lots of doctors, and they have said categorically that the great benefit of losing the weight is so huge for your heart, for the various different cancers, you know, for your joints, for arthritis, for diabetes. It's such a huge benefit that most likely, in most doctors' opinions, outweighs
which I can appreciate.
So let's go to the phones, because the phones do light up every time we even mention the fat jabs. And on the line is Dorothy. Dorothy, thanks so much for ringing about this. Would you like to see more and more people given access to these jabs on the NHS?
I certainly would, Vanessa. And also, how lovely you look today.
Oh, aren't you lovely to say so? You're very kind. Thank you very much indeed. I really appreciate it. So tell me about the jab situation with you, Dorothy.
Well, I am 84, so obviously I don't get a lot of help from anybody about being fat. Right. When I left school at 15, I weighed 11 stone. I've been big all my life, been very, very active, worked from the age of 15, and I've also done men's job, because when I first started school at 5, I couldn't read and write. They used to stand me up in the school in front of the class and ask me to read. I didn't know how to read, so they used to put me in the corner and make me stay there all day because they thought I was being naughty. So obviously I haven't been a very good person, academic at all. So I've always had to do a man's job where you haven't had to fill in forms and all sorts of things to do the job. Right. I don't know the only thing I can use on a telephone is the actual phone itself, and I can do a text message by the, like they tell you how to spell it. I've been to the doctors numerous times ever since I was, I suppose, after I had my 4 children. I had 4 children in 4 years, so I didn't have a lot of time. But I went to night work, cleaning offices all night. Yeah. My husband had the children. I came, then when the children started school, I went full time, always doing men's jobs. Yeah. I worked on building sites, I worked in factories.
So in other words, Dorothy, you've been incredibly physically active, plus having 4 children, plus working your absolute socks off. Yeah. And I'm assuming that what we're getting to here is, despite all of that, being a thoroughly energetic, productive person, you have wrestled with weight all your life. So we can't see you, obviously. What kind of a size are you? What sort of dress size are you now, Dorothy?
I'm a 24.
OK, so bigger than you want to be. So what's been the story about getting these jabs on the NHS for you then?
I've been to the doctor several times to ask him, because I can't afford them. Obviously, I'm an old age pensioner and I don't get any help from anybody because I've paid in for a pension. Right. So I don't get help. But the only thing I get free from anybody is my prescriptions. Right. I've had two knee replacements and 2 hip replacements.
So when you said, Dorothy, put me on the fat jabs, that's what I need. Look, I'm a size 24. I've really tried all my life to lose weight and I haven't managed it. I'm 84. Help me out here. What did they say?
Yeah, because you haven't got diabetes, you cannot, you don't meet the criteria.
Oh, right.
Everything is down to diabetes. And I know some people, and I really do feel sad for them, that actually make the their problem diabetes. But you go into the shops, anywhere you go, and you see massive people stuffing their faces with rubbish.
Dorothy, you're a great caller. Listen, I have to let you go. I don't want to, but I've got so many other people to talk to, but it's a pleasure talking to you. And certainly Dorothy's the kind of person that, you know, would be helped if they rolled out some more jabs.
It's crazy that Dorothy doesn't have diabetes, so they won't give her the jabs. But surely the jabs are the thing that will stop her getting diabetes. So they wait till you are ill.
And also imagine being 84 and saying, come on, help me out with my weight. And they say, no, you don't qualify. It seems to me to be a shame. And it seems to be like she's been fighting it her entire life, hasn't she, poor thing? Right, let's go to Kay in Kent. Kay, how about you? What do you think?
Well, can I just say it's refreshing to hear somebody, Nicola, talking about people like myself, and I'm sure there's many of us, that have had eating issues all of our life. I'm 69 years old now, and since the age of 14, when I had a brush with anorexia, but I managed to pull myself out of it, I've had what I would call a difficult relationship with food. Right. So every single day, I wake up in the morning and my first thought is, how fat do I feel today? By the way, I'm between 8.5 and 9 stone, size 10, but only because every day I count my calories, every day I exercise. It's an obsession, and it's an obsession that I would rather not have. The food noise is very difficult to live with, but I've learned to live with it, and I get on with it. My family know what I'm like, they know my issues, but there's no help for me. I would give my right arm to have a jab every day that would stop the food noise in my head and help me maintain a healthy weight without it being such hard work.
I wonder whether that will be developed at some point. I wonder whether, Kay, that kind of fantasy might become reality, that if something switches off a food noise in one direction, if it might do it the other way too. Do you think it might?
It does work. So I've actually taken Mounjaro, and I got it, I went down the dark route of,
got it privately somehow.
And it really works. For a month, I was free of food noise, and for the first time since I was 11, I didn't throw up. I didn't get up every morning saying exactly what you're saying. Am I fat today? Am I eating? Am I not eating? This is a constant battle and struggle for me every single day. And on that jab, I didn't have it.
So why did you not carry on it then?
I think because my eating disorder then really crept in, and I was then desperate to just be as thin as possible.
Right.
So I have to manage. I have to try. This is what I'm saying about mental health. I have to work on myself mentally, not on the jab where I just am going to get really, really skinny. But it's a battle.
I'm really glad you're here, because it really does put the other side of this. Torment, because I really think it's torment, don't you? It feels very big and you don't want to be. It's agony. Every time you're eating something to make yourself feel better, you're also damaging yourself.
Particularly for women, there's so much pressure, and we get shamed into looking a certain way.
Totally.
And that's a lot of pressure on yourself.
Totally agree. And Kay, what a great call, and thank you so much. And the honesty today, just absolutely pouring out the television as far as I can see. Thank you everybody for being so honest about this. Let's talk to Eileen in Carmarthenshire about this. Eileen, what's your view?
Well, I've got to say, going back in the day, I'm 75.
Yes.
Never had a weight problem, although I joined a certain class when I was 18, and I was only 8 stone 1. Although I'm only 5 foot, but then I was overweight. This is what this certain club was. And I do not need to be disrespectful, but I'm like you, I've been a yo-yo dieter back and forth. But this fat jab, I don't understand it, because it may suppress your appetite, but what happens, you can't keep taking it. I've had to learn over the years. I lost my husband 22 years ago, and the person I could sit here now and eat 10 bars of chocolate. But I don't. So I've just got to be able to control myself. So what's going to happen with all these people that come off this fat jab? Are they going to go back eating it? Not eating the jab, I meant just eating. Do you know what I mean?
Yes, I know what you mean. I mean, Nicola's nodding away to that.
Well, I mean, obviously I disagree with you. I think that it's not about self-control. I've got a lot of self-control, you know, but unfortunately I've got a mental health illness that means that, you know, food is, it's not even about the food. It's, you know, it's what's going on in my head and how I hate a lot of myself. So, so it's about going and getting professional help, isn't it? And working on your mental health. And if people need to stay on the fat jab forever to not feel like how I feel, why not?
Yeah, I think they're going to work out the science behind sort of, as they call it, microdosing, so that people will get to a weight that is healthy, acceptable, where they feel great, where they look great, and the doctor says this is fab, and then they'll have tiny little doses to keep themselves going. I'm not just imagining this. I've talked to lots of
and it's those
experts.
tiny little doses of helping with that self-sabotage in many ways. So it might even help like other areas of your life where you want to self-sabotage.
There's a lot of research about its effect on drug addicts
and
alcoholics because it's affecting the part of the brain that compels you to do things against your own will.
And actually, you write about this brilliantly in your book, just in case people are interested.
I mean, I'm a recovering addict myself of alcohol, and you know, I've read that and the urges that you talk about that are all rooted in emotion and are completely difficult or impossible to control.
Yes.
You know, this is what I hear these jabs control, and if you can apply them to other areas, the impact on people's lives and wider society could be immense.
It's kind of freedom from the thing that's been imprisoning you and torturing you and embarrassing you, humiliating you and all that sort of thing. Just tell people the name of the book.
The book's got swearing in it.
Oh, no, don't tell them the name. I knew I had a blank about the name. I knew there was some reason why I couldn't say the name. Don't say it.
Delaney, stop worrying. Type that and you'll find it.